Welcome back to Healthy Habit Hacks. Today we're delving into an important topic of gestational diabetes complications, risks and management. Let's start at the beginning. What is gestational diabetes? Simply put, it's a temporary form of diabetes that some women may develop during pregnancy due to hormonal changes. Now you might be wondering, what's the connection between hormones and diabetes? Well, it all comes down to a hormone we all have in our bodies called insulin. Insulin, produced by the pancreas, plays a crucial role in helping our cells take up glucose from the blood. However, during pregnancy, a woman's body undergoes significant hormonal changes, particularly insulin resistance due to hormones produced by the placenta. So what's this placenta we keep mentioning? It's an organ that develops during pregnancy, providing nutrients and oxygen to the growing fetus. But it's not just a conduit for nutrients, it also produces hormones that can interfere with insulin action, which can lead to gestational diabetes. While the exact cause of gestational diabetes is not fully understood yet, it's believed that these hormonal changes during pregnancy, especially the insulin resistance caused by hormones from the placenta, play a significant role. Now, it's important to remember that gestational diabetes is a temporary condition. It usually resolves after the birth of the baby. However, it does come with its own set of challenges and complications, which we will discuss in detail in the upcoming segments. So there you have it, a brief overview of gestational diabetes, a condition that may arise due to hormonal changes during pregnancy, involving insulin resistance and the role of the placenta. It's a temporary condition, but it's not to be taken lightly as it requires careful management to avoid potential complications. Stay tuned as we delve deeper into the risk factors, diagnosis, complications, and management of gestational diabetes in our next segment. Remember, knowledge is power, and understanding this condition is the first step in managing it effectively. Gestational diabetes is a temporary condition that comes with its own set of challenges and complications. Now, you might wonder who are at risk of developing this condition. Well, the truth is, gestational diabetes can affect anyone, but certain factors can increase the likelihood of its occurrence. One such factor is weight. Being overweight before pregnancy significantly increases the risk of developing gestational diabetes. The heavier you are, the harder your body has to work to produce enough insulin to meet your needs, and during pregnancy, this challenge can be amplified. Another risk factor is a family or personal history of diabetes. If you, your parents, or your siblings have diabetes, you may be more likely to develop gestational diabetes. This can be due to genetic factors or lifestyle habits that you share with your family. Age is also a consideration. As with many health conditions, the risk of gestational diabetes increases with age. Women over the age of 25 are more likely to develop the condition than their younger counterparts. Previous childbirth experiences can also play a role. If you've given birth to a large baby before, weighing more than 9 pounds, you might be more likely to develop gestational diabetes in subsequent pregnancies. This is because having a large baby can be a sign that your body struggles to control your blood sugar levels. When it comes to the prevalence of gestational diabetes, the numbers are quite telling. Approximately 1% of pregnancies in women under 20 are affected, but this figure jumps to 13% for women over 44. But remember, these are risk factors, not guarantees. They increase the likelihood, but they don't determine destiny. A healthy woman in her 20s with no family history of diabetes can still develop gestational diabetes, just as an overweight woman in her 40s with a family history of the condition might not. Each pregnancy is unique, and each body responds to the hormonal changes of pregnancy in its own way. That's why it's so important to attend all prenatal appointments and screenings. They can catch gestational diabetes early, allowing you to manage the condition effectively and protect your health and the health of your baby. While these factors increase the risk, anyone can develop gestational diabetes. Let's delve deeper into a specific form of gestational diabetes known as gestational diabetes mellitus, or GDM. This condition involves maternal diabetes during pregnancy and is characterized by a state of glucose intolerance. This intolerance is not something that's been present beforehand, but rather it's first identified during pregnancy screening. Now, why is this screening so important? Well, it's because early detection of GDM gives us a chance to manage the condition in a timely and effective manner. It's crucial to remember that the earlier GDM is diagnosed, the better the chances are of preventing potential complications. So let's talk about what exactly happens in the body when GDM is present. Normally, insulin, a hormone produced by the pancreas, helps our cells take up glucose from the blood. But in the case of GDM, the hormones produced by the placenta can interfere with this process. This interference causes insulin to be less effective, leading to higher glucose levels in the mother's blood, which can have a knock-on effect on the developing baby. This is why it's so important to get screened for GDM during the early stages of pregnancy. The screening process is straightforward and involves a simple blood test to check the blood sugar levels. If these levels are higher than normal, then further testing may be required to confirm a diagnosis of GDM. Once GDM is diagnosed, treatment can begin. This usually involves making dietary changes, regular physical activity, and in some cases, medication. The goal of treatment is to keep blood sugar levels within a target range set by your healthcare provider. Remember, managing GDM doesn't just affect the pregnant person. It has a direct impact on the health of the baby too. Unmanaged GDM can lead to the baby growing too large, which can cause complications during delivery and increase the risk of the baby developing type 2 diabetes later in life. Managing GDM is crucial to prevent long-term effects on both the parent and the infant. It's not just about managing the condition during pregnancy, but it's also about safeguarding the future health of both mother and baby. To help illustrate this, meet Ray, a mother dealing with gestational diabetes during her second pregnancy. Ray's journey with gestational diabetes is a daily balancing act. She meticulously measures her blood glucose level 4 times a day, ensuring she stays within the safe range. It's a routine she's become accustomed to, but not one without its challenges. Her diet has also seen a significant transformation. She's swapped out refined sugars for complex carbohydrates. This isn't just a switch for her, but for her entire family as they rally around her, embracing a healthier lifestyle. It's a change that's not always easy, and it's a change that's not always met with enthusiasm, especially from her firstborn who misses his sweet treats. But Ray's concerns extend beyond maintaining her diet and blood sugar levels. She's also cognizant of the potential impact of her gestational diabetes on her baby, and it's a worry that never quite fades. She's aware of the increased risk of her baby growing larger than average, the possible organ hypertrophy, and the long-term effects that could ripple into her child's life. Equally, Ray is concerned about her future health. She understands that gestational diabetes increases her risk of developing type 2 diabetes later in life. It's a thought that lingers in the back of her mind, a silent reminder of the need for continuous vigilance. Yet despite these challenges, Ray is not alone. She finds immense support within her diabetes team who guide her, reassure her, and arm her with the knowledge she needs to manage her condition effectively. They're her guiding light, illuminating the path towards a healthier life for her and her baby. Her family and friends too rally around her, offering a comforting presence. Their support, their understanding, and their unwavering belief in her strength fuel Ray's resolve. They're her rock, her safe haven amidst the storm. Ray's story is a testament to the struggles and triumphs of managing gestational diabetes. It's a tale of resilience, of adaptation, and of the power of support. But most importantly, it's a reminder that this journey, while challenging, is one that can be navigated with courage and determination. Ray's story is a testament to the struggles and triumphs of managing gestational diabetes. So, what happens if gestational diabetes is not managed properly? Well, gestational diabetes, if left unchecked, can lead to a host of complications for both the mother and the baby. For the mother, uncontrolled blood sugar levels can result in a higher likelihood of a cesarean delivery due to the baby's larger size. There is also an increased risk of developing type 2 diabetes later in life. For the baby, the excess sugar in the mother's bloodstream can cross the placenta, causing the baby's pancreas to produce extra insulin. This can lead to a condition known as macrosomia, or an overly large baby. Such babies face a higher risk of obesity and type 2 diabetes as they grow older. They may also experience breathing difficulties and are more likely to require care in a neonatal intensive care unit. Furthermore, if gestational diabetes isn't managed effectively, it can lead to the baby's organs growing larger than average, a condition called organ hypertrophy. This can cause complications during delivery and may affect the baby's health in the long term. But it's not all doom and gloom. Proper management of gestational diabetes can drastically reduce these risks. It's all about keeping blood sugar levels in check. This can be achieved through regular monitoring of blood glucose levels, a healthy diet rich in complex carbohydrates and low in refined sugars, regular physical activity, and medication if necessary. Support from healthcare professionals, family, and friends is also crucial. They can provide guidance, encouragement, and reassurance during this challenging time. Remember, no one is expected to tackle gestational diabetes alone, and let's not forget about postpartum care. Though gestational diabetes typically resolves after delivery, it's important to continue monitoring blood sugar levels for a few weeks after childbirth. This will ensure that the condition has indeed resolved and will help the healthcare team devise a long-term health plan. Proper management of gestational diabetes is key in ensuring a healthy pregnancy and future for both the mother and the baby. So, take heart. With the right care and management, gestational diabetes is a condition that can be effectively managed, paving the way for a healthy and happy motherhood journey.